Guys, welcome to my channel. So friends, today our video is about how does the US health system works. Healthcare in the United States is organized in a complex bureaucracy, while in the rest of the world healthcare facilities are owned mostly by governments or by private sectors. Business in the US, a large share of hospitals and clinics are owned by private non-profit organizations. Yet the United States is a country that has the highest healthcare expenditures in the world. While these expenditures are covered in a large share by public payers, as by federal institutions or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed nations, the US health system does not provide health care to its entire population. As there is no single nationwide system of health insurance, the United States primarily relies on employers who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare expenses for the fragile parts of the society, as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subject to. Getting health insurance in the US is not an easy thing. Someone may think that once you have money, everything is easy peasy, but in fact things are a bit more complicated. One must be very careful and look out to pick right insurance. Health insurance in the United States for non-citizens. The United States government does not provide healthcare insurance for all its people, and health insurance is not obligatory for those living in the US. It is optional but highly recommended and necessary since health services are very costly, more than in any other country anywhere across the globe. There are two types of health insurances in the US, private and public. Most people use a combination of both. The US public health insurances are Medicare, Medicaid, Children's Health Insurance Program. The US has the most expensive healthcare in the world. That's why getting adequate health insurance coverage comes highly recommended. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for US nationals or older than 65 years old, but also for younger people with end-stage renal disease, ALS, and some other disabilities. Data shows that in 2018, Medicare provided almost 60 million individuals with health care in the US, over 51 million of which were older than 65. The Medicare problem is divided into four types. Part A, which cover hospitals, skilled nursing and hospice services. Part B is covers outpatient services, including some provider services, while inpatient and hospital outpatient hospital charges. Part C is an alternative called Managed Medicare, which permits patients to select health plans at least the same service coverage as Part A. Part B often the benefits of Part D, and an annual out-of-pocket spend limit which A and B lack. To sign in the Part 1 must sign in Part A and Part B. Part D covers mostly self-administered prescribed prescription drugs. Today our video is about that. If you like my video, then please subscribe my channel.